Hi everyone, welcome to our webinar tonight. Tonight, I'm coming with a very interesting topic. It's called Healing Childhood Wounds in Adult Love. And in this webinar, we are having a look at how father wounds or mother wounds shape dating and relationship. So this is Sarah Green. I'm a provisional psychologist and relationship therapist and coach. So in this webinar, we are having a look at our earliest relationship with our parents and see how that shape our adult connection and relationship, and also the path towards healing and transformation. So in this webinar, there are three things we focus on. First one would be understand the concept of parental wounds. Second, we will learn how these wounds shape dating patterns and intimacy. And after that, third, we have a look at psychology and coaching tips to break this cycle. So what are childhood wounds? So these are some emotional injuries we carry from unmet needs. It can be neglect, it can be abuse or inconsistency in parenthood. So it's often unconscious. When I usually ask people, they think, oh, I had a good childhood, you know. They just, most people, they don't notice, or maybe they just, remember a few bad memories, but, some of these memories are gone. But there are for like most people, like many needs are in are not kind of are there, that some of them are met by parents, some of them are not met, because no parent is perfect. And every human has many needs that need to be met, like need for love, need and affection, need for validation, need for setting boundaries, healthy boundaries, and lots of other needs, and consistency in relationship. So, for example, um, there are some wounds like not feeling enough or fear of abandonment, fear of other people might leave us, called abandonment, or difficulty in trusting others because trusts are broken in childhood or even in the past relationship. So what is the father wound? When a father is absent or is critical or emotionally unavailable or abandoning a child, usually it has an impact on women. The women who have father wound, they usually seek unavailable men. Why they do that? Because they want to they seek someone similar to their father. Their father hasn't been available, so when they see unavailable man, it's familiar. So they usually seek unavailable men, struggle with trust because trust is broken. Their father has been absent, unavailable, so they cannot trust on men. They crave a lot of validation from the men, so that also happens. So they become sensitive when they don't receive validation. They might, overreact. And the impact on men when they have father wound is difficulty with identity, because the man, they get their identity from their fathers. This kind of men, usually they are indecisive when they want to make decision. They are, they don't know in choosing job, life purpose. So they are lost. It says there is a very interesting book called Absent Fathers, Lost Children, kind of that. Lost Men actually is the name of the book. But because it's the effect of father wound on men. When the father is absent, the men kind of become lost in different ways. They have issues with authority. So they have issues with self-confidence. They lack self-confidence usually. And also they, similar to their dad, they usually replicate emotional distance. So they become kind of similar to their dads. So for women, they seek unavailable man, someone similar to their father. For men, they become like their father, kind of. So they, because a girl's first love is her father, and a boy's first model of manhood is his father. So a boy look at his father to learn manhood. So if his father has been unavailable or emotionally distant, usually the boy replicate that. So now look at the mother wound. Like, how is mother wound? When a mother is critical, enmeshed, means has dependent personality, so much like enmeshed with their children, neglectful or emotionally unpredictable, one day nice and warm, one day short, or like, she is kind of unpredictable in her relationship with the child. Usually, what comes up through this is people with this wound, they struggle with self-love and self-acceptance. So impact on women would be perfectionism if the mother is critical. It would be self-sacrifice because they want to play a role of, good girl. They low self-esteem. They don't believe in themselves because the mother has been, neglectful, critical towards them. They have difficulty receiving love because they think they are not lovable. And what is the impact on men? When a man has been a mother who the mother has been unpredictable or neglectful or critical, a man usually have fear of intimacy, fear of become close to the women. And they usually, this men choose partners who is similar to their mother, and their mother rejected them, criticized them, or didn't see them. They choose similar partners, and the same story again repeats. So now we have a look at attachment theory and the parental wounds. When there is like father or mother wounds, this can create unhealthy attachment styles, insecure attachment styles. What are insecure attachment styles? Anxious, you see on the right-hand side top, which when they have fear of abandonment, so they become anxious and clingy, the person, then we say anxious attachment style. Or we have like avoidant, who they have fear of closeness. So then we say, avoidant attachment style, which they shut down and avoid. And or we have disorganized, another insecure attachment style, which they push pull. So they are confused. Sometimes they are warm and close, and sometimes they shut down and pull back. So they are inconsistent. So disorganized attachment style. But if the parents has been like, meeting the needs, has been consistent, the child have secure attachment style, feel safe and connected in a relationships. Attachment styles are not 100%. One person might be, for example, 30% anxious, 70% avoidant, or like be like 50% secure, 50% anxious. So there are some tests that you can do. Each person is good to know, what is their attachment styles, because in this way, then they know how they react in the relationship. I don't know why it's frozen. I hope it's sorry, my page is frozen. To next. Stop sharing. I don't know what's happened. Okay, now it works. Okay, again I share. Don't know what's happened. Just frozen and it wasn't going to the next box slide. Okay, now I resume it. Okay, recording is there, which is fine. Cool. We continue. Okay, that's good. So this cycle actually repeats. So it's and then like the same like things that unconsciously happen in childhood. They usually when they seek for a partner, a person unconsciously seek a familiar things, not what is healthy. So that's what's happening unfortunately in the relationship because for example a woman with an abandoning father usually dates emotionally distant men, hoping that this time he will stay or he will change this man. And it's the same with other wounds. We usually seek, like in a relationship, something that is familiar, like to our father or mother. And if it's unfamiliar, it doesn't attract us. So then what are the common patterns in dating and love? Father wound patterns. They chase unavailable man. They have fear of rejection, or the same with the men, like might chase unavailable women or have fear of rejection or over giving, too much giving because of fear of rejection. The mother wound, what it causes, fear of feeling unworthy, difficulty setting boundaries, becoming the rescuer, you know, when the moms has been like critical, unavailable, unpredictable, then they might become like a rescuer. They want to save everyone else. They just sacrifice. They don't say no to others. They have difficulty setting boundaries. This comes from mother wound. And there are some red flags in a relationship that you can find out. For example, a person, if you yourself or your partner become triggered by silence, that's a red flag. Usually anxious people can be triggered by kind of silence, or over analyzing text can come from a fear of rejection. People who have abandonment wounds and fear of rejection, they usually overanalyze text to make sure they don't harm the other person and the other person don't leave them. If the person has fear of commitment, some people are in a relationship, they don't want to commit, or they have fear of abandonment, means fear of kind of the other person leave them, or they might be over controlling them or checking them, or just become jealous. All of these can come from lack of self-worth and come from fear of rejection. So these are some red flags in a relationship. It doesn't mean red flag doesn't mean that you need to leave the relationship. You need to know that the person you are dealing with has this wound, and then how you can heal this wound, that is something that we will have a look. So the inner child in the relationship. So inner child, what is inner child? Inner child, all of us has a child inside, which, always looking to kind of satisfy some of their needs. When we become vulnerable, something happens to us. I think all of you have noticed that someone like a child inside you, they really, it's been time that you become vulnerable and your child inside you needs the same needs that has in childhood. Someone sees that child, someone's give validation, someone gives love, understands, give empathize with that child. So this child always with us, no matter how old we are. There is a child inside us, especially when we become angry, disappointed, sad, or in a situation which is triggering us. That child needs the same needs which are not met in childhood. So there are some signs that your inner child is driving love life. If, for example, you have outbursts, angers, sudden angers, if you have overreactions, if you need constant reassurance, if you feel helpless without a partner, always want to be in a relationship and without a partner you feel empty. This is like your inner child needs this meat, and it's not kind of the needs are not met. So now just listen to yourself and ask this question, what my child inside me needs right now? So you can have dialogue with your inner child. Every now and then try to check this child inside you and saying, why I don't feel well, checking with yourself, what do I need today? Have I received this? Have I done this for myself? What kind of needs are not met for me? Why I'm angry? Maybe, I haven't done this for myself. Always try to look at how you can give things to yourself to make this child happy. No one else will do for you. Others might do if you communicate, effectively, asking your partner, other people, for example, I need this. They can do in like some extent, but don't expect that the child inside you, you are the best person who knows that child. So check with that child. Very often check with that and see how is this child doing. Is it angry now? Is it disappointed? Does it need love? Does it need, and what needs are not met? So that is one thing. And how we can heal the wounds. The first thing is the awareness. So, for example, if your father has been absent or unavailable, so what my father taught me love is. What did you learn by when your father left you? Did you learn that love won't last? Did you learn that, for example, if your father has been available and kind and consistent, maybe you have learned love is eternal, love is everything, you can trust men and all this. If he hasn't been, so then you have learned other things about love, which is unconscious, or about the mother as well. My mother, her behavior, what she thought about love is. So try to find out. And today I believe love is, try to write down this one, then you can find out unconsciously what do you think about love. I think all of you heard this from people. Oh, I don't need anyone. I'm good by myself. All men are like that. All women are like that. All these things say one thing. Love doesn't last. Love is not good or is not for me or something like that. But this is unconscious. People don't know that, and it shows in other ways. So see, what do you believe about love now? Check with yourself. And notice how beliefs from childhood show up in your adult life now. So then how can you heal this wound? So it's called reparenting. There is a very powerful therapy. It's called a schema therapy, which anyone like has a kind of problems with over like relationship, repeated failure, or kind of challenging childhood. I highly recommend a schema therapy. It's called kind of limited reparenting because the therapist become a healthy role of a parent who hasn't been available. It's very interesting. The therapist go through childhood memories with you and then comes there and then support you and then love you and kind of can play a role of a healthy adult for you. So it's corrective experience. It's very interesting. So, and then this limited reparenting, if you learn, you can do for yourself. That's something that everyone kind of should create a parent inside themselves, that parent be compassionate, caring, kind of set correct boundaries, and at the same time look after you. So if the parent inside you, if you tell yourself all the time, why you didn't do that, why you do that, you are not, lovable, you are silly, you are idiot, this is not a healthy parent. This is a parent who punishes. So listen to the voice inside your head because usually people take the parent, what the parents did to them becomes the parent inside them. So then reparenting means creating a healthy parent inside yourself. You can do it like one of the ways is daily affirmation, saying I'm enough as I am. I'm lovable. You can do with affirmation. You can do by kind of doing things for yourself, checking with yourself, showing compassion with yourself, rewarding yourself. So nurturing rituals such as self-care, compassion exercises, all this can help to correct those wounded kind of experiences in childhood. So how to heal these wounds? Another way would be emotional regulation, mindfulness and grounding can help. Trying to stay present and connected to your body when your emotions arise, saying, oh, I can see now you are sad. For example, I tell myself, Sarah, I can see now you're sad. That's okay. Everything will be fine. I'm here for you. Don't feel silly to say these things for you. If everyone, leaves you, you have yourself, I have you, and I will support you. So that's called kind of being in a moment, practicing mindfulness and finding emotions in your body. And then self-soothing statements like, it's safe now, I'm not the child anymore, you're safe with me. And the other things, breathing and movement, some physical techniques to regulate nervous system during emotional triggers. So emotional regulation helps to heal these wounds. The more our nervous system become regulated and calm, and this self-regulation really helps to heal these wounds. So how to heal these wounds in the relationship? A healthy relationship can heal these wounds. Choosing your partners who reflect your healing, not your wounds. Most partners, what happens after a while? They just, mirror each other through their wounds. If a partner feels unworthy, the other partners usually, when fight happens, they say things to make that person feel more unworthy. So they find their push buttons, they find their triggers, and after a while, trying to push that triggers. But a healthy partner traits has empathy, consistency, respects, and when they know your wounds, they try to take a role of a healthy parent. So the third thing would be forgiveness and compassion. Not about excusing parents, but understanding their limitations. It's very important for healing these wounds. You heal your relationship with your parents. There is something like in therapy that I have learned. If you want to like have a loving relationship and a healed relationship, you need to kind of forgive the people who have hurt you in the past. If all your kind of energy is in love, then how can you give this love to other person? So forgiveness and compassion, especially with your parents, is very important. No matter what they did, they haven't been perfect. They have done just what they knew. So they couldn't give what they didn't have. They probably didn't have, themselves those myths. They haven't met by their parents. So they repeat the cycle. But you are the one who can break the cycle. So try to reframe the narrative. Reframe it in your mind in any way you want, but you can write a letter, not send to your parent, but express your pain that you have gone through and then release them and forgive them in a letter, which is very good like practice. So this is called compassion focused therapy, and narrative therapy really helps. So then you can have some like journaling and self-awareness checks, like from time to time when you are getting triggered, try to do some self-reflection and see what has triggered you, what is linked to your childhood that has caused that. Is it any unmet needs by your mother, for example, or your father? They just, did something and now you're bringing into your relationship. There are some exercises about inner child compassion exercise, and also in a relationship, how to set boundary and communication skills. All this can help that you heal. So if I want to put in summary and say the main points would be childhood wounds create some adult patterns, and there are healing paths towards it. Your past does not define your future in love. And at the end of the day, if you want to kind of design a personalized healing plan, I'm here to help you. You can have a free 30 minutes discovery call. And also there are like some packages that you can buy, therapy, coaching that helps you to kind of heal this wound. Thank you for joining this webinar. And we are reaching to the end of the webinar.